Hi, my name's Phil. I'd like to talk about politics, and in this video I'd like to discuss how a leaked memo to the media reveals that the government are abandoning yet another promise to protect our most vulnerable in care homes. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, when you look at the COVID death toll in England, now the worst in Europe of course, it's quite clear that our government have failed us very, very badly. We're a wealthy country. And we'd carried out exercises to plan for such a scenario years ago. There was no excuse for not being ready, certainly no excuse for not being as ready as a number of other countries that were much quicker to react with less time than we had to react. Now, although the government try and claim unexpected circumstances, there is no basis for such a cowardly dereliction of responsibility. The cold hard facts are that our government went against international scientific and medical advice when dealing with the virus. They went against the recommendations in their own exercises to be implemented. They claimed they knew better. The results are entirely down to them. But just how many deaths are a direct result of the government's callous disregard for life, I do not know. There will be a study for that later, I suppose, because there would have been deaths. Even if we'd responded competently and compassionately, there would still have been deaths. However, when it comes to care homes, we absolutely could have prevented almost all of those untimely deaths. We were talking about places where the spread of the virus was much easier to control than in the general population. But our government chose to discharge 25,000 elderly patients from hospital directly into care homes without bothering to make sure that they weren't infected first. This was a deliberate policy. It wasn't just an oversight, it was pointed out to them. So the government's actions led to the infiltration of the virus directly into closed environments with our most vulnerable. Then they helped the virus spread by not obtaining and distributing sufficient stocks of PPE for staff in care homes. And the government have the nerve to say that they threw a protective ring around care homes. What they actually did was to put it in concrete boots and chuck them overboard. They also should have been routinely testing staff, certainly, but also residents, quite frankly. Now, we have known since early on in this particular crisis just for us, that the bulk of infectious people are asymptomatic. We learned that from countries that were hit earlier. That means that people not displaying any outward signs of having the virus could pass the virus on. So routine testing, absolutely essential. That's not something we've only learned recently. The government promised this for key workers a long time ago. Never happened. Then, more recently, they promised it for care home workers over the summer. Now, the Sunday Times newspaper has seen a leaked memo sent to local authorities on Friday from the government's adult social care testing director, Professor Cummings. No, I don't think it's any relation. Which says that the timelines for rolling out this routine testing in care homes are being abandoned due to unexpected delays. Now, what I want to know is, what are these unexpected delays? Because unfortunately and outrageously, Parliament decided to piss off on holiday for the summer. Otherwise, I can be quite certain that this Wednesday, a certain Keir Starmer would be asking Boris Johnson just that question. What were these unexpected delays? As it is, there is nobody to ask. Because, okay, sure, journalists can try, but the only ones the government are even responding to are those who don't ask those sorts of questions. Because I'd be willing to bet that whatever those unexpected delays are not unexpected at all. It will probably run along similar lines to, oh yeah, so what we did, right, is we put in massive orders for testing kits from this guy that Dominic met down the pub, and it was all going to be marvellous. They said they could supply us with all the kits we'd need. But would you believe it? Now they say they can't supply them after all. It's totally unexpected. I suspect it would run along similar lines. Now, routine testing was supposed to already be underway, weeks ago, in fact. Now, I knew it wasn't because there were so many reports of care home workers not getting these tests. It wasn't just isolated incidents, it seemed to be quite widespread. Now we're being told that the system say we're being told, as a result of a leaked memo. This was not a public announcement, but we are effectively now getting the message that the system won't be in place until September the 7th, 2 months after it was supposed to be in place. And who knows how high the rate of infection will have risen by then as well. But I would treat even that deadline with scepticism, because after all, this is a government that, correct me if I'm wrong, hasn't met a single deadline yet regarding COVID aims. And they've been quite happy to throw out all sorts of deadlines. Haven't met any. The memo also said that the system for registering the test was unnecessarily burdensome. Her words. Burdensome means it's a hell of a job filling it in. Unnecessarily means just what it says. Basically, badly designed. We have a badly designed system for registering these tests. Again, what do they expect when instead of letting the NHS, Public Health England, manage the whole thing, take the lead on testing, they broke up responsibility amongst a load, and I mean a load, of disparate private companies, many of whom had no knowledge or experience of dealing with health matters. So you created two problems. One is you had companies with no health expertise involved in the response to the most serious healthcare crisis in our lifetime. And you also had many groups involved where individual responsibility was hard to pin down. You know, because when you've got lots of private companies involved in a thing, they're not exactly known for coordinating well between themselves. Some of them will coordinate well enough within their own their own company. They may well be run efficiently from that point of view, but not between each other. We've seen that. The Times quoted a senior public health official saying that this would undoubtedly lead to more lost lives. So testing is a shambles. Of course it is. I've said it before. When the government are hiding the numbers on people being tested, you know it's because they aren't testing enough people. If it was good enough, they'd be quite happy. In fact, they'd be proud to release the figures to us. And our supposedly world-beating tracing program is also getting worse. It was never good enough, and it's getting worse. The same article noted that only 52% of contacts are being reached as a result of the system. Now, immediately the thought struck me, hang on a minute, that's even lower than a couple of weeks ago when Keir Starmer pointed out to the Prime Minister that the proportion of people being contacted was going down, not up. How can you get something that badly wrong, that a system actually gets worse as time goes on? Seriously, how does that happen? Shouldn't it be getting better with experience? Shouldn't it have had its teething troubles at the start and you work through them and it gets better? Maybe it didn't get better quickly enough or anything like that. That would be maybe a valid criticism. To actually get worse. And yet more scandal, because the article is saying that a number 10 official, which usually means Dominic Cummings or at least one of his stooges, said that they were thinking, God, this would be setting the cat amongst the pigeons. They were thinking of making test and trace someone else's response, basically taking it away from the Department of Health because it's a product of, in their words, Matt's mates, Matt Hancock, the Health Secretary. Perhaps they think it would be better in the hands of Dom's mates, you know, like that tracing app that pissed away 12 million quid without anything in return. And it also said that the Treasury are pissed off that testing wasn't widespread enough to allow for more people to go back to work, you know, which of course is hitting the economy. You know, they were noting that £10 billion has apparently been spent on this system and it's not working. So you've got an awful lot of rankling inside government, you know, between Matt Hancock of the Department of Health, Dominic Cummings. I would say Boris Johnson, as you're talking about, spokespeople from number 10, but Dominic Cummings, let's be sensible here, as well as Rishi Sunak of the Treasury, because obviously the Chancellor's key focus is on the economy. He knows he's up against it, but the more people can go back to work, the better. But they're all looking at this system now and going, well, it's not working. We're not getting what we want. So you get an internal little squabbles happening as well. And if they do take it away from the Department of Health, that would be hideously embarrassing for Matt Hancock. I mean, I'd said some time ago, you know, I feel that he's been set up as the main fall guy. But I also said that I have no sympathy for him. he was considered reasonably competent. I mean, not a nice person, not someone who's got the best interests of the country or people at heart, but a competent minister. He knew that everything that he's done and had to defend during this COVID crisis is wrong. He knows that. He had a choice. He could have chosen to distance himself from it. He could have said, no, we're not going to do it like that because that's stupid. We're going to do it like this because that's what we're being advised to do. And dared Boris Johnson to sack him. And if he did sack him, he can go onto the backbenches and cause trouble from there, just as his predecessor, Jeremy Hunt, is doing. But no, he chose to stick by this ridiculous position. And if he's made the fall guy for it, I have zero sympathy for him, because he could have chosen to make a stand against what he knew was a bad system. But he nailed his colours to Johnson's mast, a person who will not stick by him in return. But there it is. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.